Stomatitis can happen with EGFR inhibitors, and here in the picture showing really red and inflamed ulcers that are on various areas on the oral cavity, and this can really interfere with the patient's quality of life because it can impair the eating, and then it can cause burning. Next slide, please. So it is a good idea to check in with the dentist once in a while to make sure there's no mechanical reasons to develop stomatitis, and using ultra soft or softer toothbrush can be recommended. And when there's really bad burning by this stomatitis, using minimally flavored toothpaste, such as children's version of toothpaste, can be helpful. And then mouthwashing without sort of irritants there, such as alcohol, can be utilized to moisturize the oral cavity and also soothe pain. When there are multiple lesions in the oral cavity and causing pain and burning, we often think about using steroid mouthwash. It can be either dexamethasone mouthwash or magic mouthwash, which can work like magic, though there's no magic there. If there's only a few areas that we need to treat in the oral cavity, then we can use high-potency corticosteroids for those specific spots to treat the symptoms. And then if there is any clinical suspicion for infection, and we can send viral and fungal swabs for further investigation. Next slide, please. So diarrhea can be challenging, and thankfully with the third generation EGFR TKI osimertinib, it's not really a bad problem at all. When diarrhea happens, we utilize loperamide as the mainstay of therapy, and this is the way I usually tell my patients how to take loperamide. So first, if there's an episode of diarrhea, you take 2 capsules, which is 4 milligram, followed by 2 milligram, which is 1 capsule after each loose stool, up to 60 milligram per day. And you can think about using Lomotil and other anti-diarrhea medicine if loperamide doesn't work well. And diet modifications such as less greasy, spicy fried food and dairy products, if lactose intolerance is suspected, can be done. And hydration is important, and we always tell our patients to drink adequate amount of fluid water. If the diarrhea is severe in the setting of, let's say, osimertinib, then I would really think about other etiologies such as infection, because severe diarrhea is really rare with the sort of more specific EGFR-TKI drugs such as osimertinib. And in the setting, we do IV hydration, and it's reasonable to hold EGFR-TKI therapy as the workup is ongoing.